So Dr. Santini, which genetic mutations and cytogenetic changes are associated with a more favorable response to MDS treatment?
That's a very a good question and very updated question. I am able to give you an answer that I would like to renew in a couple of years and to give a more complete one. But for the moment, we already have some specific chromosomal alteration that can be linked to a better prognosis and good response to some agents. For instance, the presence of a loss of a specific part of a chromosome, the chromosome 5, gives rise to a specific subtype of MDS that is usually having a very mild prognosis, a good prognosis, I would say, and respond to a specific therapy with lenalidomide. But more recently, a specific gene mutation, SF3B1, it's a specific gene that is present in patients who have also an alteration of their erythroid progenitors, so the progenitor of red blood cells. They accumulate iron in mitochondria, so in a position that shouldn't accumulate iron. But this abnormality, actually, it's correlated to a very good prognosis. So these patients have a very long overall survival, as we say. They live well, but not perfectly well because they will need transfusion. So the prognosis is somehow good, but at the same time, this patient will need transfusion. So they will need to increase their hemoglobin levels. So there are specific mutations and specific chromosomal alteration that give a very good prognosis or a good prognosis, but that does not mean that the patient doesn't need the therapy. And I would also like to add the fact that the more mutations or chromosomality you have, the more frail is your genetic asset, and the more difficult would be to treat in a successful manner. The presence of the mutation of the gene called SF3B1 confers high probability to respond to a specific drug that is called luspatercept. And it is a drug that is able, in this specific subset of patients, to give a high percentage of transfusion independence. So as a matter of fact, as I said, despite the fact that these patients have a good prognosis, they may need transfusion. And on the other hand, they may take advantage of therapy with this specific drug.